Hello, and welcome to the Clinical Liver Disease video series. I'm Gina Choi, a transplant hepatologist at UCLA and associate editor with CLD. I am here with Monika Sarkar, who is associate professor of medicine at UCSF and the author of Reproductive Health and Liver Disease, a patient-friendly summary of the 2021 AASLD guidance, publishing soon in CLD. Dr. Sarkar, thank you so much for joining us.
Thanks so much for the invitation.
Okay, so we're going to get started with a few questions. Number one, this is the first practice guidance about reproductive health and liver disease. What do you think was the impetus for this guideline?
So the guideline really emerged out of the Women's AASLD Initiative Committee. And I think we recognized that there was a resource gap where we needed to provide some education, some algorithms to help empower our colleagues in managing pregnancy and liver disease. And I think it was really timely because it really paralleled what we were seeing in our real life day-to-day practice with a rising number of patients with cirrhosis who are headed towards pregnancy with other forms of chronic liver disease. So I think quite timely in that nature as well.
That's fantastic. The clinicians and the women, thank you. First, another question is, how has the growing prevalence of NAFLD affected reproductive health, especially regarding fertility and pregnancy outcomes?
So it's a great question. I think we're seeing no doubt a rise in the number of pregnancies with non-alcoholic fatty liver disease, for example, closely tied with preeclampsia, gestational diabetes. We published a paper in 2020 that in Journal of Hepatology showing a nearly tripling of the number of pregnancies affected by NAFLD. So this has really shifted what we're seeing. Again, large and growing numbers of women who are coming to our practices with chronic liver disease, having these potentially adverse outcomes and really needing optimization in the preconception period and undergoing multidisciplinary management with our MFM colleagues to optimize their outcomes for moms and babies.
Absolutely. In 2018, there was a recent paper published that was considered a landmark paper now, where they found that women aged 25 and 34 had the highest average annual percentage change in mortality from cirrhosis, aka more younger women are dying from liver disease. Are these studies documenting a similar growth in chronic liver disease among women of childbearing age?
Mm-hmm. No, that's a fantastic point, and it was a great article. And I think it certainly mirrors what we see with at least the pregnancy statistics. So in the United States, we published a paper in the Red Journal earlier in 2022 showing a rising number of pregnancies affected by cirrhosis. That was across the United States using the National Inpatient Sample Database. And then in Canada, Jennifer Fleming and their group published a similar paper that was out of gastroenterology in 2020, also showing this really marked rise in the number of women who have cirrhosis that were having childbirths. So we're seeing a growing number of pregnancies in the reproductive age population. And we see also in the NAFLD statistics, so the most marked rise in incidence is in adolescents and young adults. So that encapsulates also reproductive age women.
Wow. So it seems like you're... Oh, no, go ahead. I'm sorry.
I was just saying, while we're seeing this for alcohol, NAFLD, viral hepatitis, we're seeing similar trends. So the CDC has lovely estimates where they're showing a rising number of reproductive age women with Hep C, women who have pregnancy who are being diagnosed with Hep C, and that parallels the opiate epidemic. So across the board, we're seeing this with many different types of chronic liver diseases, really highlighting the importance of managing, identifying these patients earlier, and again, really optimizing the preconception through postpartum nuances of liver disease.
Right. Another reason why your publication is so timely. Just for the students out there, do you have a mnemonic for how to keep straight what contraceptive options are recommended in patients with liver disease?
I love this question. I wish I did. But I think the take-home point is that there's a breadth of contraceptive options, and the majority of them are safe for all women with chronic liver disease. There are three groups of women for whom estrogen-containing agents should be avoided. So remember, estrogen-containing agents just means you're on a combined hormonal contraceptive. That's women who have hepatic adenomas, women who've had Budd-Chiari, so they're predisposed to having clots. Estrogens do promote that risk. And then women with liver failure. So either you have cirrhosis and you've progressed onto decompensation with liver failure, or you've had a liver transplant and you're losing your graft with consequent liver failure. So those three main categories.
I see. I mean, there's a fantastic table that you included in your publication that I think people are going to find very helpful regarding contraceptive and liver disease. And I guess the last question is just, what are three important takeaway points from your article that you want clinicians to know and even patients to understand?
Yeah, no, that's a great question. So it is indeed a patient-focused document. And for the providers who are tuning in, it's really important to use this to help with asking, educating, and referring your patients. So it's a great resource to print out, provide your patients the link to begin those conversations. You should routinely be asking, are your patients sexually active? Do they wish to get pregnant? If they don't, are they using any forms of contraception? And for many practitioners, the idea or the nuances around reproductive health might seem outside the scope of practice for what they do on a day-to-day basis. But just ask if they're sexually active, ask if they're using contraceptive methods, what they want to do for pregnancy planning, and get them connected, with a hepatology provider who focuses on that area. Get them referred earlier to MFM to have discussions about pregnancy planning. And the nice thing about this document is it's written for patient level, which means that our providers can really digest this material as well. So it's a good resource to educate both patients and providers and help to have that conversation and have it early on.
That's amazing. Please know how much your work is appreciated. I think this is an important area of study that is definitely getting more attention. You're definitely leading the way in this area of research. And I know I, as a clinician, very much appreciate, like you said, a very digestible document that kind of reminds us what's important in women's health, especially in liver disease. So, Dr. Sarkar, thank you again so much for making time to have this interview. I'm very excited about this patient guidance, and I think a lot of people will benefit from it. Thank you so much.
Dr. Choi. Take care.
Okay, bye. Thank you.